Good morning, ladies and gentlemen. Here's my disclosure. This slide shows a summary of the available device in the femopopulator intervention. Although FDA have a specific statement for appropriate use of paclitaxel-based devices, PMDA doesn't have a specific announcement for reducing the use of paclitaxel-based devices. Also, recruitment in these clinical trials do not pause after JAH paper, especially cancer study just started from this October. So I'm going to present the current PTX issue in Japan. So this slide shows the impact SFA Japan 3-year RCT data. Although the 3-year primary patency was significantly different, but the 3-year cumulative incidence of the all-cause deaths was not significantly different. So interestingly, follow-up compliance is higher in out of US than US. Rate of 3-year follow-up visit attendance in Japan was 98% and 100% at DCB and the PTA respectively. On the other hand, rate of 3-year follow-up visit attendance in both US and Europe is less than 90%. Especially the big difference between the PTA and the DCB in the US group was found. After JHA publication, we retrospectively review our database to clarify whether the PTX device would impact on mortality in patients with femopopulator disease. Because DCB has approved at the end of 2017 in Japan, the patient treated with the Zilver PTX was only enrolled in this study as a PTX group. Here, main result of current study, Kaplan-Meier curve shows that 3 and 5 years mortality was not statistical difference between the PTX-coated group and the PTX-free group. Distribution of deaths was almost comparable, and the non-specific cause of death was increased. Based on this result, we concluded that mortality risk following the application of the visible PTX stent did not increase over 5 years. So next, I'd like to discuss whether the PTX device impact on the increasing the major amputation or not. Our clinical question is whether the DCB use adversely impact on the limb prognosis due to the downstream effect. This question should be solved in the real-world population, not in trial-based population. First, so we should confirm the substantial phenomenon of the downstream after DCB use in the clinical setting. So this patient had a diffuse SFA to popliteal stenosis as well as a 3 BTK occlusion. After successful vessel preparation, lesion was dilated by 3 DCBs. Angiogram just after DCB therapy is showing that a slow flow phenomenon was observed. Slow flow phenomena in BTK lesion was also found after DCB therapy, and the ischemic wound was spontaneously worsened. So here is a time course of wound healing after DCB angioplasty. After 3 weeks, complete wound healing was achieved. At the same timing, follow-up angiogram was done and revealed that no slow phenomenon was found through the SFA to BTK at day 21. From this clinical scenario, downstream effect angiographically found at the initial procedure, it didn't affect the time course of the wound healing. So we have been collaborating with the pathologist and the request to investigate whether the substantial finding from the downstream effect caused by DC was pathologically assessed by amputated toe. So Dr. Finn already presented a downstream finding in the porcine skeletal muscle. Red arrows indicate a crystalline material. Our pathologist found 2 major findings. One is a crystalline material similar to Dr. Finn's report in previous paper. Another one is a coil-shaped material. Probably this is similar as a hydrophilic polymer emboli. Under recognized iatrogenic cause of ischemia was already reported, and we should pay attention to this phenomenon. Anyway, we can pathologically confirm the downstream effect in the CLI patient. So finally, effect of a downstream effect was evaluated in our institution data. We have an ongoing project for DCB use in the CLI with tissue loss. 5 high-volume centers were cooperated to proceed this study. So interim analysis of a latest study shows that there are no significant difference between the DCB and the non-DCB group in terms of healing and amputation-free survival. Further investigation will be needed to clarify the downstream effect by DCB use. It's a fictional fact. Thank you for your kind attention.